Ladies and gentlemen, can I please have your attention? And I need all of you to stop what you're doing and listen.
Welcome to DBIAS, an educational platform harnessing social media. We provide behavioral, statistical, system, and philosophical literacy for both clinicians and patients to elevate the reasoning and narrative behind healthcare decisions. It's pretty hard to genuinely debias our millennia-old, self-serving, and at times predictably irrational perceptions of the world around us. Fighting the insurmountable mixed messaging and misinformation of the so-called information age is an even more Herculean task.
Houston, we have a problem.
We hope the era, that's evidence-referenced advice, of DBIAS provides accessible illumination towards more informed choices. We convey tools to better interpret and interact with the world of healthcare across our literacy series spanning 4 overarching themes. First, behavioral literacy includes psychology, well-being, communication, and clinical consultation techniques.
I have no doubt that you would be bored senseless by therapy.
I hope that you can always be honest with me.
Well, I'm often never honest with you.
Second, philosophical literacy covers epistemological and axiological concepts, i.e. knowledge and values in medicine.
Philosophy.
Truth, logic, that sort of thing.
Third, statistical literacy helps to identify the spin and neutralize the noise in medical research and epidemiology.
They've done studies, 60% of the time, it works every time.
That doesn't make sense.
And fourth, system literacy provides a grasp of public and population health, health economics, leadership, and management.
Leadership. The word ship is hidden inside the word leadership as its derivation.
We also publish the Thought You Knew, Think Again series of explainers for clinical scenarios with widespread misconceptions, dispelling common myths or disproven practices.
This isn't real.
What is real? How do you define real? You've been living in a dream world.
We're less interested in the latest innovation or technology update and more focused on overlooked current knowledge in order to reduce the immense evidence practice gap that we see in the real world.
These days, if you've been out of med school 5 years, half of what you learn is obsolete.
In many areas, we don't need more studies. We need improved accessibility and translation of established evidence into policy and daily practice, i.e. knowledge translation. And that's where DBIAS comes in. So, subscribe to stay tuned for tips and resources to elevate your healthcare choices.